University Hospitals Birmingham NHS Foundation Trust runs the Selly Oak and Queen Elizabeth Hospitals in Birmingham. As part of its commitment to providing the best care, UHB recognises that dignity is one of the most important issues for patients who come to the hospitals.
We know we give excellent clinical care. The Trust is renowned for that. What we want to make sure of is that they get care that respects the way they are as individuals in their daily lives. It's about individuals feeling safe with us.
I feel with the nurses, they are very good. I feel as though I'm treated like a human being.
Many of them are quite vulnerable and frightened when they come into hospital, so it's important that we get care right for them. We've got 250 dignity champions, not just clinical champions, we're also recruiting porters and domestic staff, people in the front of house, as well as doctors and nurses and physiotherapists.
With a proactive and enthusiastic dignity and care team leading a huge number of dignity champions working in many different roles, the Trust is putting innovative measures in place to ensure patient privacy and dignity is respected at all times.
We're doing a process called Back to the Floor, where our senior nurses are reviewing what patients are receiving in terms of care on those wards.
Issues like just smiling and talking to people and being reassuring to them as they come onto our wards, whether that's patients or their visitors.
Part of the way that we've done that is to look at making sure that we've got gowns that protect their dignity, particularly in the critical care environment.
Selly Oak and Queen Elizabeth Hospitals care for over 600,000 patients every year. Some patients have specific needs, and the Trust makes every effort to treat everyone as an individual with dignity and respect. The Trust is particularly focused in offering the best possible care to its older patients.
Things like ensuring that older patients have got a food diary, so we've got a record of what they've had to eat, and obviously fluid charts so that we can show what they've had to drink. It's so important when their relatives come to visit that we can demonstrate that they've had something, and particularly if you've got somebody who perhaps doesn't remember what they've had to eat, we're able to show that it's important to us as it is to their families that they're continuing in that way.
There are an estimated 570,000 people with dementia living in England, and a quarter of patients in hospital are thought to have the condition. UHB is at the forefront of developing new ways of caring for patients with dementia.
There are people from all over the hospital concerned about the management of frail people, and particularly those with dementia. One innovation is the Memory Lane Cafe, for example. I think the training that has been going on now for particularly the last 2 years, has spread the message that dementia is important in our acute hospitals, and we have to look after people comprehensively, not just with their particular acute problems.
The Trust also has many initiatives aimed at providing the most appropriate care for our patients with learning disabilities.
The other thing that we've been doing is working really closely with the health facilitators for learning disabilities. They're very specialist nurses who will work closely with us, with the patients, with their carers in the community, and support them through, say, complex procedures or through surgery, explaining things to them.
Try to use easy words. Try not to change their voice and speak to them like a child. They just need to break the language barrier down.
They often have something called a hospital book. That's prepared in advance so that when they come into hospital, we can get to know them very quickly and learn exactly what their needs are and how we can best meet those needs.
We are currently moving into the new Queen Elizabeth Hospital Birmingham, the city's first new acute hospital for 70 years. This new development offers great opportunities to improve the way in which patients are treated and cared for.
The facilities in the new hospital are fabulous. As we move in and patients begin to come into their new wards and departments, they'll find that we've got 44% single rooms. All of the single rooms have got ensuite facilities, so patients will have their own shower room, toilet, washing facilities. The rest of the accommodation mainly is made up of 4 bedded rooms, and each of the 4 bedded rooms has got its own shower room, bathroom and washing facilities. Now, the other thing that's very important to us is that we make sure that men and women are separated so that we get away from this mixed-sex accommodation, so there will be no mixed-sex accommodation in the new hospital.
Thank you for watching this video. If you have any concerns or would like further information about the services we offer, we would love to hear from you.